Well, I'm Dr. Jim Del Rosso, the editor-in-chief of the Journal of Clinical and Aesthetic Dermatology, the JCAD, and we are now going through a lightning tour of the June 2026 issue of the journal. So I want to start by looking at the Residence Corner. And James Treat, who is a professor of clinical pediatrics and dermatology at the University of Pennsylvania. And I know Jim Treat. He's a great guy, he's a great speaker, great educator. And he talks about why pediatric dermatology is an awesome specialty. He talks about pediatric dermatology, which is often looked at as, yes, if you have an interest in it, it's certainly an important area. There's a lot to be learned. There are a lot of great educators, but it's thought of as a specialty that there's poor financial compensation. And that's not always necessarily the case because it really depends on what the situation is. In academic centers, sometimes a location. And it really is a lot beyond that in terms of the level of satisfaction. It's a great community. It's a small group, and there are not a lot of pediatric dermatologists. We do not have a fellowship trained pediatric dermatologist in the entire state of Nevada. In the city of Las Vegas, which has more than 2 million people, there is not a fellowship trained pediatric dermatologist. There's not one in the entire state. So it's open for opportunity for individuals that are interested in pediatric dermatology, which covers a wide range of areas and interest, a great community educationally. So I think it's worthwhile read. And maybe if you've never thought about pediatric dermatology, you might. And great people in pediatric dermatology. A letter to the editor, celebrity influence on public health, the Kardashians and melanoma. And this goes back to 2023, where Khloe Kardashian had a melanoma. And it looks at Wikipedia page views and Google Trends over a 2 week period. And it looks at what happened. And this was from May 25th to May 31st. The number of page views as soon as it was announced that Khloe Kardashian had a melanoma over that time spiked through the roof over that time period. A little bit more interest in melanoma, no increased interest on page views related to sunscreen use. So it was the celebrity interest, but I'm not sure how much it stuck with the community on the importance of melanoma. Maybe it did, but I guess when things happen to famous people, those things become famous for a short period of time. Now we're looking at an article that was written by Joshua Burstein, who is a dermatologist. He is actually a chief resident at the Department of Dermatology at the University of Illinois, Chicago. He's the lead author. There are several authors on this paper. I was the senior author, but Joshua was the one that really did a lot of the heavy lifting in writing for this particular article. But every author was involved significantly with this publication. I do want to make clear that there is nothing related to the promotion of any particular therapy. It's very important, however. It's the topical prescription therapy for psoriasis, an expert position paper on limitations of published guidelines and treatment selection with updated recommendations. The focus is not to consider any particular therapy, but to take the decision making out of the hands of how guidelines are erroneously used by third parties to decide whether therapies should be approved or not. That is not the intent of the guidelines. And this article goes through how all the guidelines say ultimately the clinician with the patient together define what is best for that patient. And it goes through some of the limitations of guidelines, some of the guidelines that are put together by different groups and panels of recognized individuals aren't updated for several years, sometimes 5, 7, 10 years. So a lot of the newer therapies aren't even in the guidelines. So I would suggest looking at this article. It calls for the decision to ultimately be made by the clinician and the patient together based on what they need, because the only one that's there with the patient is not the journal article or some committee that's sitting somewhere in another city making these decisions. It's the clinician and the patient together. And I think it's a very worthwhile read. And it also calls for companies and clinicians to all work together to make medications accessible, especially ones that may be associated with a higher cost. So that is, I think, a very, very important article. Now, another article is a combination approach to hyperpigmentation, unveiling enhanced aesthetic results with microneedling and pigment correcting peel. And Sunil Chilukuri and others put this article together, and it really does a very good job of talking about how microneedling in combination with a pigment correcting peel could be of benefit to patients. They have some excellent photographs and some excellent data on giving suggestions on how to optimally use this approach. The next article, and the senior author is Natalie Zatoni, who is very, very good in cutaneous oncology. Uh, and the lead author is Henry Gian, and there's also Sarah Berman that are involved in this paper. And it's the use of hedgehog pathway inhibitors in combination therapy for basal cell carcinoma, a review and a narrative synthesis. It goes through in detail all the data we have on the hedgehog inhibitors for basal cell carcinoma in monotherapy and combination therapy. And it makes the point how the tolerability of the therapy is often better with combinations rather than relying more heavily on monotherapy where you may get into more side effects. An excellent article if you're confronted with basal cell carcinoma where you're utilizing this hedgehog therapy and how to optimally consider combination approach. Now, this next paper is very, very interesting because it includes 20 patients that had culture confirmed trichophyton indotinea. Now, trichophyton indotinea became popularized in 2019 from outside the United States as a dermatophyte that was highly resistant to oral terbinafine, which typically has excellent activity against dermatophyte organisms. And these were Tony cases that were collected in New York City that were identified. The article is very thorough and has outstanding photographs of these patients. It looks at series highlighting diagnostic pitfalls and therapeutic uh, considerations. The lead author is Han, and there are several other authors on this. 20 cases. I think what's very important is, first of all, recognition and the consideration of identifying this because of the terbinafine resistance. The majority of cases were responsive to oral itraconazole. My coffee is wearing off. Oral itraconazole, uh, but it was frequently recurrent and important to identify these patients so they could be optimally evaluated and treated and recognize that it could be passed very readily to individuals within the same home. So it's not only outside the United States. These were 20 cases from New York City. Some excellent photographs. Now, another article by Margaret Mercante, Emily Tocco, and Diego Ruiz de Silva is very interesting because it's overlapping sarcoidosis and atopic dermatitis in a Black American female. A single case report, but I think of significance because of a rare coexistence. And we certainly see atopic dermatitis, but it's interesting that there's overlapping sarcoidosis. So this is a 58-year-old Black female with refractory cutaneous uh, sarcoidosis that had atopic dermatitis that did not respond to some conventional therapies, especially looking at the sarcoidosis, that did extremely well with oral upadacitinib, which would certainly address the atopic dermatitis and also was very, very helpful for the sarcoidosis. So it's something, if you encounter that, you would certainly go through all the steps to evaluate the use of an oral Janus kinase inhibitor in the patient and all what's recommended in terms of clinical and laboratory monitoring, but was extremely helpful in a patient that was battling this with difficulty for some time. The next article is a case series of hypopigmented, confluent, and reticulated papillomatosis, with the senior author being the CARP King, Rajiv Natu, who has been involved with other colleagues publishing on other presentations of hypopigmented, confluent, and reticulated papillomatosis, recognition and treatment. And this was a case series of hypopigmented presentations. So thank you, Dr. Natu, and your colleagues for keeping us up to date on CARP. Now, a fundamental of dermatology article series. This is the first in what we hope is going to be a periodic series with David Sider, who is a nurse practitioner in the Phoenix area, Scottsdale area of Arizona, and myself. And this one addresses, when is cutaneous vasculitis more than just a rash? And this is designed to be relatively succinct, but very, very thorough in just some tips on how to approach whatever the topic is. In this case, patients with cutaneous vasculitis, which is typically going to be leukocytoclastic vasculitis or palpable purpura. So David Sider did a great job of putting together three tables. Table one is the history and presentation directed workup. Table two, the histology directed workup. And table three, the direct immunofluorescence directed workup, giving you the high points of what is relevant and what you might want to do if you see such patients. And finally, an extremely thorough article for anyone who's interested in treating atrophic scars, which can be very, very difficult, as you know. This is the use of chemical reconstruction of skin scars cross method with trichloroacetic acid for atrophic scars. It's a comprehensive review on application techniques, adjunct therapies, and complications by Scott Strathman and Helen He. This goes through in detail a total of 937 patients that were managed with atrophic scars on utilizing this particular technique with trichloroacetic acid. There's an extensive table reviewing the patients and specifically what was done in this particular situation and some excellent photographs. So that's it for June 2026. I hope you enjoy it.